close to the end of our diagnoses here is spinal stenosis. This also may come up on an MRI that you've had in the past, and it sounds kind of scary. It's another one of those diagnoses that a lot of people have. Some people don't really have any symptoms from. Other people do have very severe symptoms. So we have two different types of stenosis. One is central stenosis and one is lateral stenosis. So when we talk about the spinal cord, in some of the pictures that I showed earlier, you know, we have the bones that surround the spinal cord and really protect our spinal cord from damage. As you age and as you get some of that arthritis I talked about earlier, and as some of your ligaments thicken, some of that presses in on the cord and makes the area for the spinal cord smaller. There's also something called lateral stenosis, and essentially what that means is near the area where those joints are that I talked about with the arthritis, which we can talk about with this picture in a minute, is essentially that same area where the nerves come out that go down your legs. So if you have stenosis in those areas, you are likely going to have pain down your legs. So what are you going to feel? You may have, again, pain in the buttocks, thigh, or leg, and likely it's going to be worse when you're standing up or walking. So the first question I'm going to ask you when you come into my office is, how far can you walk? Can you walk 1 block? Can you walk 10? Can you walk a mile? And that really gives me an idea of how bad your stenosis is. And this is something that's not going to come, this particular diagnosis isn't going to be something that comes on very quickly. It's not going to be something that just hits you like this. It's going to be very gradual in onset. So this is kind of a nice picture of the progression of stenosis. This is kind of what I mentioned before, where this is the disc in your back and the bones are back here. And this nice, big, white, round area is the area that your spinal cord lives in. And as you can see here in this picture, it's not so round anymore, not as much room. And then in this picture, it's really even less room. So the spinal cord, which likes to live in this, ends up living in this space. So it's not too happy. So again, what can we do about it? And this is a common theme. Relative rest, you've heard. You've heard about some of the medications that we give. And then you've heard about some of the rehabilitation. So when I say rehabilitation, I don't mean, you know, a couple of hot packs and ice and just a little bit of a massage. I really mean exercise and stretching and working with a therapist on the things that you specifically need to work on. We can also do those injections I talked about if the therapy is not working or not getting you to 100% of where you want to be. And then our last resort is really surgery. So again, sort of a common theme. Last resort is really surgery. Another thing that you may have heard of is something called sacroiliac joint dysfunction. That's the joint at the very bottom of our spine. I mention it only here sort of briefly because it's somewhat of a controversial diagnosis. The joint itself does have some nerves supplying it, so we do think that there is some sensation or feeling in that joint, but it really hasn't been proven, so it's hard for us to say for sure one way or the other. But people do have pain in that area, and it can feel like a pain in the butt. And again, what can we do about it? We'll do things like core strengthening. We'll work on the kinetic chain. Well, what does the kinetic chain mean? It means everything from the ground up. So, for instance, if you, if you also have knee pain associated and you can't bend your knee very well while you're walking and your gait or the way you walk has changed over time, that's going to affect your ankle, it's going to affect your hip, and it's going to affect your back. So we target all of those areas in physical therapy. And then finally, we can do some of the injections that I talked about earlier. I see a few people who are of age where they could be pregnant in this room, and there's certainly a number of reasons to have back pain in pregnancy, and we also take care of that. There are limited options when you're pregnant in terms of medications and injections and things like that, so we really try to keep it very conservative and take care of it as much as we can while you're actually pregnant. So some things of prevention that I want to talk about before we finish and get to some questions is I want to get back to this picture that I was talking about, the different positions and how much pressure it puts on your back. So again, laying down at night, your back is really happy. There's not a lot of pressure on it. Your muscles are resting. Your discs are sort of loading up their water content so that when you do stand up, they're nice and juicy. So standing, also not too high in terms of pressure, but I just can't hit home the point enough that sitting is probably the worst possible thing you can do for your back. And I don't mean, don't sit ever. I just mean don't sit all day, okay? So I know a lot of us sit at our jobs for a number of hours. What I recommend is every 15 to 30 minutes, just standing up. And it only takes a couple of seconds for your body to sort of adjust to that change of pressure and just takes the pressure down. So they've actually stuck needles into people's discs and measured these pressures. That's how they came up with these numbers. And it's just really important for your spine health to be up and down. So if you can't remember to do it, sometimes people like to have these sort of like fitness band type things that can vibrate. You can set them to every 30 minutes and they kind of remind you, oh, it's time to get up. Or if you have a water cooler or if you need to go to the bathroom, all that stuff can just get you out of your chair. Another thing that I just want to mention here is this little picture, which I don't know if you can see that well, but this person is doing a sit-up. So you're thinking, well, I thought sit-ups were good, right? Well, sit-ups are good, but we want you to do them in what we call a neutral position. So activities that I prefer for things strengthening your core are things like planks or some other things that maybe if you've done Pilates are similar. So that's something that a therapist can work with you if you do have low back pain, or if you have if you go to a gym, or if you have someone that is knowledgeable in core strengthening but in a neutral position. That's what I personally prefer. And it all goes back to this, that it puts less pressure on your disc.
What do you mean by a neutral position?
So what I mean is so that your spine stays straight and yet you're not going like this. So that machine in the gym that has you sitting and you push down is probably the worst machine ever made. So if you do that and you like it, that's okay. But there are a lot of alternatives for strengthening your core that don't involve putting a lot of pressure on your back. So what are the main things that you can do? Maintaining a healthy weight, and I can't emphasize how important this is. Every extra pound you have in your stomach adds a number of pounds to your back. And it seems funny, but the way it works is essentially you're pulling your back forward and you're basically just smashing on those bones and discs. So maintaining a healthy weight is very important. Again, getting up and moving every 15 minutes. I don't really care what you do. If you just stand up in place, if you want to walk around the room, whatever you've got to do, just get up out of your chair. Sometimes I find people have low back pain or even upper back or neck pain because they carry a really heavy bag on one shoulder. And I think that we're all guilty of this in New York City because we have to carry our stuff a lot of times. So we end up having these big heavy bags. But a backpack can be a nice alternative for that because it's distributing the weight nice and evenly. Another thing is to lift with your legs, not your back. So instead of bending over to pick something up, if you sort of squat down and use your legs instead of your back, is really helpful. And finally, regular exercise. So I recommend 30 minutes of vigorous cardiovascular exercise 3 times a week. So what does vigorous mean? Does it mean walking around the block? Maybe. It could. If you're a little bit feeling out of breath, if you feel like you could not have a full conversation with someone, but you could say a couple of words, that's vigorous exercise. So any activity that you like to do, just do it, 30 minutes a day. So, and that doesn't have to be all together either. It can be 15 minutes at a time, it can be 10 minutes at a time, 3 times a day, whatever you want. And then the last thing is, like I mentioned, we do take a look at your workstation, and we can make some suggestions for how you can make that better. For instance, you definitely want to have your monitor. This is sort of a common problem, is that people's monitors are too low. When you look at your monitor, you want to have your eyes at the top third of the screen. So for instance, this actually is pretty good for where, well, maybe not. My eyes should be about here. A lot of people have their screens much lower. Another thing is you want to have your feet on the floor, you want to be sitting up nice and straight, and so if you have a chair that's adjustable, that's really helpful. If you don't, then we can make some adjustments. So for example, there's this kind of lumbar roll that we can help you find, and some other devices. And then this is that nice picture of a plank that I was talking about, which is one of my favorite core strengthening activities. So, now I'll take any questions that you might have.